The introduction of ASI-Seg, a novel audio-driven surgical instrument segmentation framework, marks a significant departure from existing segmentation algorithms that solely rely on direct instrument detection without consideration of the surgeon's intent. This intention-agnostic approach is plagued by limitations, such as inaccurately segmenting unnecessary instruments, resulting in inefficient operating room workflows and increased cognitive burden on surgeons. ASI-Seg mitigates these shortcomings by incorporating an intention-oriented multimodal fusion strategy that extracts relevant instrument information from audio commands to guide the segmentation process. To distinguish required instruments from irrelevant ones effectively, the ASI-Seg framework utilizes a contrastive learning prompt encoder, thus facilitating improved instrument retrieval. Comprehensive experimentation reveals ASI-Seg's exceptional performance advantages over traditional state-of-the-art algorithms and medical spatial attention mechanisms (SAMs) in both semantic and intention-oriented segmentation. Specifically, the experimental results indicate notable accuracy gains and a more effective differentiation of intended and non-intended instruments. Through an integrated, two-branch multimodal learning design, the proposed ASI-Seg approach empowers effective extraction and exploitation of instrumental semantics. Leveraging cross-modal correspondences within surgeons' verbal cues, he gains deep contextual insight for effective target recognition, obviating significant efficiency disparities vis-a-vis less attention-enabled top-line instrument trackers. Thus, this contribution systematically constructs knowledge bases at these domains synergized operations vis-a-vis intention to integrate, operating efficiently together more flexibly along these steps into integrating mechanisms grounded entirely other components where workflow results under significant optimizing et novel as demonstrated not conclusively working solutions current out. The ASI-Seg approach introduces a novel intention-oriented multimodal fusion to segment specific surgical instruments according to the surgeon's intention. This framework diverges from existing studies on surgical instrument segmentation, such as Turneus-Net, ISI-Net, Dual-MF, S3-Net, and Wang et al.'s work, which directly segment all instruments of predefined categories. In contrast, ASI-Seg leverages an intention-oriented multimodal fusion to interpret the surgeon's intention and retrieve details for segmentation. This approach is inspired by the Segment Anything model, SAM, for medical imaging, which has shown advantages in image segmentation across various scenarios. However, most medical SAMs require significant computational resources for fine-tuning or rely on manual annotations for prompt during inference, making them impractical for clinical usage. The ASI-Seg framework segments required surgical instruments by following audio commands of surgeons. This framework comprises an intention-oriented multimodal fusion module, consisting of an audio intention recognition module, a text fusion module, and a visual fusion module. The audio intention recognition module predicts the surgeon's segment intention using a MEL spectrogram transformation and an audio encoder. The text fusion module injects detailed language description information into a group of learnable queries, while the visual fusion module injects richer visual information. The intention-oriented multimodal fusion module incorporates equations and algorithms, including the MEL spectrogram transformation, audio intention recognition, text fusion, and mutual cross-attention mechanism. This approach enables the accurate segmentation of surgical instruments according to the surgeon's intention, overcoming the limitations of existing methods. The ASI-Seg framework consists of two primary components: intention multimodal fusion and contrastive learning prompt encoder. The intention multimodal fusion module generates intention-oriented features by fusing textual and visual information through the instrument query module. This module takes the textual feature and learnable query as input, producing a fused query through attention mechanisms and matrix multiplications. The instrument query module is defined by the equations Qt equals softmax, Qt-KTC square root d, Vc, Qc equals softmax, Qc-KTT square root d, Vt, and Q equals MLP, concat, Qt, Qc, where Qt, Qc, Kt, Kc, Vt, and Vc are attention queries, keys, and values from textual feature Ft and learnable query Fc, respectively. The instrument query Q is a fused result of QT and QC, concatenated and reduced to a single dimension using a multi-layer perceptron. The visual fusion module extracts cross-modality visual information from the input image using the instrument query. This is achieved by computing the similarity between the instrument query and image feature, resulting in a sequence of similarity matrices. The image feature is then added to the similarity matrix sequence to obtain the multimodal features, which contain both image and textual information. The feature assignment with audio intention module divides the multimodal features into required and irrelevant feature sequences based on the surgeon's intention. This is achieved using the contrastive learning prompt encoder, which provides the mask decoder with a specific prompt for the instrument to be segmented. The contrastive learning prompt encoder employs a mutual cross-focusing mechanism between the required instrument feature and the irrelevant instrument feature, enhancing the focus on the unique properties of the surgical instruments to be segmented. The contrastive learning module further pushes relevant instrument features and irrelevant instrument features to be separable, enabling accurate segmentation results. The proposed framework effectively distinguishes between required and irrelevant instrument features, capturing complex relationships between textual and visual information through multimodal fusion, contrastive learning, and attention mechanisms. A comprehensive comparison of surgical instrument segmentation methods is presented on the ENDO-VIS 2018 and ENDO-VIS 2017 datasets, highlighting the effectiveness of the ASI-Seg framework. This framework leverages intention-oriented multimodal fusion and contrastive learning to enhance feature discrimination and segmentation capability. The ASI-Seg model is optimized using two loss terms: dice loss for segmentation and contrastive learning loss to dynamically update the learnable query. The results, as shown in tables I and II, demonstrate that ASI-Seg outperforms state-of-the-art methods in terms of challenge IOU, and mean class IOU, MIC-IOU, on both datasets. The superior performance of ASI-Seg is attributed to its ability to effectively fuse multimodal features and dynamically update the learnable query through contrastive learning. The implementation details reveal the use of pre-trained image, text, and audio encoders, which enable the model to capture comprehensive representations of surgical instruments. The optimization process involves a careful tuning of hyperparameters to ensure optimal performance. The significance of ASI-Seg lies in its potential to improve surgical instrument segmentation accuracy, particularly in laparoscopic procedures where precise identification and tracking of instruments are critical for safe and effective operations. By enhancing segmentation capability, ASI-Seg can contribute to improved surgical outcomes and reduced complications. The ASI-Seg model demonstrates superior performance in both semantic and intention-oriented segmentation tasks on the ENDO-VIS 2017 and ENDO-VIS 2018 datasets. In semantic segmentation, ASI-Seg outperforms other methods, including surgical SAM, with a significant IOU advantage of 2.04% and 1.70% on the ENDO-VIS 2018 and ENDO-VIS 2017 datasets, respectively. This improvement indicates enhanced capacity to distinguish surgical instruments from irrelevant ones and complex backgrounds. In intention-oriented segmentation, ASI-Seg achieves superior mean class IOU of 64.18% and 68.17% on the ENDO-VIS 2018 and ENDO-VIS 2017 datasets, respectively, surpassing advanced SAM approaches. Notably, ASI-Seg exhibits a 5.31% advantage in mean class IOU over the second-best surgical SAM with category prompt. Qualitative comparison, as shown in Figure 2, and quantitative analysis, presented in Table 3, further support the effectiveness of ASI-Seg in segmenting various surgical instruments, including bipolar forceps, prograsp forceps, large needle driver, and others. The results demonstrate the ASI-Seg model's ability to accurately segment surgical instruments in endoscopic images, highlighting its potential for enhancing surgical navigation and improving patient safety. The ASI-Seg framework exhibits superior performance in intention-oriented surgical instrument segmentation, achieving balanced accuracy across various categories of surgical instruments. A comparison with state-of-the-art methods, including MASC2 Former plus SAM, Track Anything, PerSAM, and Surgical SAM, on the EndoVis 2017 dataset reveals that ASI-Seg outperforms these methods, as shown in Table IV. Qualitative analysis of segmentation masks generated by ASI-Seg in SAMBASED approaches highlights ASI-Seg's proficiency in identifying and classifying diverse surgical instruments. Unlike SAMBASED approaches, ASI-Seg does not require manual annotations or assigned categories for prompt, and accurately understands the segmentation intention to generate precise masks of the required instruments. A robustness study investigates the impact of defective audio commands, such as mispronunciations, on ASI-Seg's performance. The results, illustrated in Fig. 3, demonstrate that ASI-Seg remains capable of recognizing the correct instrument category and completing accurate segmentation despite verbal errors. This robustness is an advantage over text instructions. An ablation study, presented in Table V, validates the effectiveness of the proposed modules in ASI-Seg. The integration of the instrument description bank results in an 8.42% increase in mean class intersection over union, MIC-IOU, confirming the importance of textual knowledge in cultivating distinct learnable queries for different categories. The addition of contrastive learning in ASI-Seg yields a 4.98% increase in MIC-IOU, attributed to its ability to dynamically emphasize required instrument features and attenuate irrelevant ones. The ASI-Seg framework accurately segments required surgical instruments by parsing audio commands from surgeons. The intention-oriented multimodal fusion interprets the segmentation intention and retrieves relevant instrument details to facilitate segmentation. The contrastive learning prompt encoder distinguishes required instruments from irrelevant ones, guiding ASI-Seg to segment the required surgical instruments. This minimizes distractions from irrelevant instruments, assisting surgeons in promoting workflow in operating rooms. Extensive experiments validate the ASI-Seg framework, revealing remarkable advantages over classical state-of-the-art and advanced SAMs in both semantic segmentation and intention-oriented segmentation. Please provide the transcript of the research paper that needs refinement. I'll transform it into a concise, technically accurate summary suitable for voiceover narration, following the guidelines you provided.